Why do some patients and their family members leave their physician's office fully understanding the information they have been given and successfully follow their clinician's treatment plan? And why do other patients leave their physician's office uncertain or confused about the information they have been provided and do not attempt to follow the treatment plan at all, or they attempt to follow the plan but do it incorrectly? There are many answers to these questions, and undoubtedly there are many contributing factors, but numerous studies and experts consistently find that the quality of communication is a defining component of healthcare quality. Effective communication is the cornerstone of the therapeutic relationship between healthcare professionals and patients and their family members. This dynamic program from Novartis Pharmaceuticals, the second in a series entitled The Pearl Method, Enhancing Communication Skills to Build Caring Relationships and Improve Health Outcomes, enables busy physicians and healthcare professionals to review their communication skills and presents practical techniques with the goal to improve patient outcomes. This program, like the first Pearl Method program, is an opportunity to bring a dynamic and enjoyable team-based professional development program to medical offices. Program topics were selected to assist physicians and office staff to better manage the limited time they often have in caring for their patients in order to build trust as well as improve adherence and health outcomes. The content covered in this Pearl Method program includes using visit agendas to engage patients, improving patient interactions by using specific communication skills, effectively using electronic medical records to enhance patient communication, and using visual aids to enhance patient understanding. The program will assist healthcare professionals to integrate into office visits specific techniques to engage patients with a personal greeting to establish rapport and build trust. Further, program participants will learn skills to more efficiently utilize their time with patients through negotiating a visit agenda based upon what is most important for the patient and how to structure the visit to better meet patient expectations. Healthcare professionals will review how to ensure information is clearly communicated by successfully engaging patients when using electronic medical records and integrating appropriate visual aids, and collaboratively developed written care plans to enhance patient understanding and self-management.
And I remember you telling me it is important what I eat.
What other things would you like to discuss today?
I can't think of anything.
Okay. Well, I'm really glad you're educating yourself about nutrition, and I'll be glad to answer any of your questions. Before we get into that, I wanted to introduce you to our new computer system. We now keep all of our patients' records on the computer, instead of the paper charts we've always used. It's already starting to make our jobs easier and keep your information at our fingertips. I believe Debbie, my nurse, has already shown you how it can keep track of your blood pressure readings. We'll also use it for your medication list, allergies, lab work, and other medical information. It'll take a while for us to get used to it, but I'm confident that it will help us do a better job tracking things and taking care of you.
Physicians and other HCPs often confront different communication challenges. Therefore, the Pearl Method provides discussion group lessons and resources for physicians and discussion group lessons and resources for other medical office healthcare professionals. The flexible format enables the program to be presented in a series of interactive discussion group lessons, enabling physicians and other HCPs to explore new concepts as well as to review important interpersonal communication skills. Medical offices may decide to utilize the program as an opportunity where all members of the office team participate together, or offices may implement the program in discussion group sessions for physicians and separate sessions for other HCPs. Communication skills and techniques are demonstrated in a series of case study lessons that reflect common communication challenges encountered by physicians and healthcare professionals working in medical offices.
This is something we can work on together. Just so I'm sure I explain this clearly, can you tell me what you've heard so far?
I think you're right, that I am probably feeling depressed. And you're saying that I can get help for it?
That's right. Your emotional health is just as important as your physical health. Would you be willing to talk to a counselor for a few times?
And I see here that you brought in your fasting blood sugar record. This is terrific. Thank you so much for bringing this in today. And you filled out the forms, the one about your family health history and the one about today's visit. That's just great.
Yes, I had to leave some of the lines blank because I couldn't remember all the details. But tell me, did I fill out the same forms last time I was here?
As a matter of fact, you did. And Doris, we're hoping our patients will fill out the today's visit form every time they come in. Helps us to know if anything new is going on or if you have any specific questions or concerns we may need to address. That way we can add to your care plan any issues that come up and keep track of how you're doing so we can manage your health better.
Each case study lesson begins with a brief description of the medical visit, followed by a video vignette with actors playing the parts of physicians, healthcare professionals, and patients and their family members. The first case study in each discussion group lesson highlights an example of ineffective communication, followed by a case study portraying effective communication.
Hi, the doctor asked me to come in and check to see if you guys had any questions, but I have a patient waiting for an EKG, so gonna make this brief. So you've got the prescription that the doctor mentioned, and you should know what that's for if you have any other questions. The pharmacist can help you out with that. It's always a good idea to talk to your pharmacist about medications. Besides, once you get the medication, they'll print out a piece of paper that explains everything.
To summarize, Mr. Kearns, you'll go to physical therapy 2 times a week for now and do the exercises they prescribe. And with the help of your wife, you'll start a weight loss program. I have a care plan for you all typed out. Please look at it, let me know if you have any questions, and then please sign it if you agree that this is the plan we've developed together today.
Well, looks fine. We'll see how it goes. I remember what a mess I was when I first started taking those blood pressure pills. The written care plan really helped.
Following each video scenario, the program moderator, Preston Ribnick, president of Professional Resources Group, asks the actors portraying patients and family members to share their feelings about their care experience.
This was my first visit since they started using the new computer system. I've read that doctors were starting to use them, but this is the first time I've seen it. I really appreciated that Dr. Williams and her medical assistant, Debbie, took the time to show me how the system works. I was worried about someone hacking into it, but Dr. Williams assured me that she's confident it is a good system. I also like how I can see the information Dr. Williams is putting in my record, as well as my test results. It helps me feel I know what is happening, and Dr. Williams is able to print out her instructions for me at the end of the visit.
The moderator then reviews key teaching points illustrated in the case study.
This scene clearly illustrates the differences between rushing through the visit compared with engaging and collaborating with patients and their family members. Elena began by reviewing the written care plan that the physician and patient developed during the previous visit. By asking open-ended questions and active listening and observing, Elena was able to discern that Mr. and Mrs. Kearns needed additional information. Patients must fully understand their condition if they are to be successful in self-management.
Program components include discussion group facilitator guides and participant handouts. The Pearl Method is an excellent refresher educational program for physicians and other healthcare professionals who have provided patient care for many years, as well as an opportunity to explore communication skills for HCPs new to their offices, and assists HCPs to build caring relationships with their patients to achieve improved health outcomes.